Imagine if your child's hips suddenly started to deform without any warning, making every step more painful than the last. Well, that's exactly what happens with acetabular necrosis. Stay with me to learn the signs you absolutely shouldn't ignore.
Subscribe.
A 7-year-old boy starts complaining to his mom about hip pain, especially after playing at the park or running with friends. What worries her is that there hasn't been any fall or trauma. She decides to consult a chiropractor because, at least in Canada and Quebec, it's faster than waiting in the emergency room. Sorry, but it's true. During the exam, after considering the child's symptoms and some concerning orthopedic tests, the chiropractor explains that the signs strongly suggest a condition known as acetabular necrosis, also referred to by a more technical name, Legg-Calvé-Perthes disease, where the blood supply to the femoral head is interrupted, leading to the death or necrosis of tissues around the hip, acetabular necrosis. But to better understand your child's symptoms, it's essential to first look at the structures affected by this disease. The primary area involved is the femoral head, the upper part of the thigh bone that fits into the acetabulum of the pelvis. For medically unclear reasons, this region starts to lose blood supply, leading to progressive degradation, which affects both the shape and function of the hip. Although acetabular necrosis mainly impacts the femoral head, changes can also be seen in the acetabulum due to mechanical alterations and abnormal pressure in this area. This is a rare but serious condition that predominantly affects children between 4 and 10 years old, with a peak incidence between 5 and 7 years. And now, you may be wondering why this specific age range is more vulnerable to this disease. Good question. But to be honest, we have more theories than certainties. We don't know the exact cause of the blood supply deficiency, but it's suspected that the blood circulation in children isn't as well developed as in adults, making them more vulnerable. This directly affects a critical phase of childhood, when bones and cartilage are rapidly growing, leading to potential permanent joint deformities that are very difficult to heal. Boys are 4 times more likely to be affected than girls. Children with a family history of similar conditions, blood clotting disorders, repeated trauma, or even a higher body weight, which puts additional pressure on developing joints, are also at increased risk. But age remains the key factor. Diagnosis, however, must be confirmed with an X-ray or an MRI if the X-ray is normal or if more detailed information is needed about joint degradation. Additionally, blood tests may be performed to rule out other conditions that can mimic this disease, such as another condition common in this age group, often referred to as hip flu. Don't worry, I'll come back to that by the end of the video. Now, let's finally talk about the symptoms you absolutely need to watch out for in your child. First, sudden hip pain without any trauma or after overuse from sports, which tends to worsen with physical activities and may radiate to the thigh or knee. A limp due to pain and discomfort, hip stiffness, and loss of movement, especially after long periods of inactivity. Unfortunately, treatment for this disease remains unclear, with no scientific consensus on either conservative or invasive approaches. However, conservative treatments aim to maintain joint health and promote healing. One thing that seems clear is that it's better to avoid weight-bearing activities that put repetitive pressure on the affected joint, which could flatten or widen the femoral head over time. While there are no specific recommendations, I can't help but think that light aerobic activities like cycling or swimming might be beneficial and could serve as helpful tools to begin your child's rehabilitation at home. What is recommended, however, is a conservative approach with an exercise program that strengthens the joint without putting unnecessary pressure on it. If you're looking for specific exercise options that won't compress the femoral head, write hip exercises in the comments, or the link will be available in the video description or at the end of this episode. Finally, it's important to understand that even without treatment, this disease usually improves on its own within 2 to 3 years. Oh yes, I almost forgot to mention the other condition, which is less severe but can affect children in the same age group, hip flu. Fortunately, the links for the exercise video and the one on hip flu or transient synovitis should appear right now. In the meantime, share your stories, suggestions, or simply ask any questions you may still have, because an informed person is in control of their health.